We're going to go live to our next group down in Cape Girardeau, St. Francis Healthcare System. We have Larissa and Gwen that are going to zoom in, and they're going to show you directly inside the world of imaging and radiology. Larissa and Gwen, thank you for joining us today.
Hi.
Oh.
So you guys are going to take us right inside the world of imaging and diagnostics. I know it's a critical care field that so many young people are interested in today. And so I'm just going to go ahead and turn it over to you. And you go ahead and give us your kind of rundown on what it's like to work in imaging.
All right, perfect. Like you said, my name's Gwen Long. I'm the manager of imaging services here at St. Francis Healthcare. And I'm going to talk to you today about what all that means as far as imaging services and how you can learn to do it for yourself if you would like to. You can probably see I have a lot of initials behind my name. That stands for Certified Nuclear Medicine Technologist and a Registered Technologist in CT. If we can go on to the next slide, please. And you're probably thinking imaging services. Well, what's that? Most people probably know us as the radiology or the X-ray department, but we're more than just X-rays. We have several different modalities, and you can see some of those images on the screen now. We do just have X-ray. We also have interventional radiology. We have CAT scan or CT, MRI, ultrasound, and nuclear medicine. Next slide, please. So we'll start off talking about diagnostic radiology, or just plain X-ray, as you probably know it. This is what everyone thinks of when they hear radiology. Basically, what happens is we pass X-rays through a patient to get an image. It's just a static image with everything on top of each other. And we can use this to evaluate hardware. As you can see some of the metallic things in these images. We can look for broken bones. We can see all kinds of things with just that image. We can go to the next slide, please. But there's also a lot more that we do. We can also do fluoroscopy. And in the slide on the left is actually a swallowing study. And you can see the patient actually swallow contrast as we can actually follow the patient as they are swallowing contrast to make sure that it goes down their throat and not into their lungs or anything like that. The image on the right is showing us a lumbar puncture. And that is a procedure where we would see someone's spinal fluid, and we want to make sure we're having the needle in the right place to inject any medicine or take any samples that we might need. Next slide, please. The next thing we'll talk about is interventional radiology. And it's a little different than diagnostic in that we are looking there. We are also sometimes diagnosing a problem, but we're also doing a therapeutic measure where we're trying to fix the problem. As you can see on the left, that's an example of kind of what one of those rooms look like. It's more, you can think of it along the lines of a procedure that's done like something in the operating room, except it's done in the imaging department. And we do a lot of things with the images on the right to evaluate blood flow, things like that. Look for clots. There are many, many things we can do in interventional. Next slide, please. And these images show us some examples of what we are actually doing in interventional. The one on the left is a heart catheter exam. It's an example of angiography. And we would use that to look for a blockage in someone's coronary arteries. And we can also at that time place a stent that would open that back up and prevent that patient from having a problem on down the line. And the same with the one on the right. That is actually, though, we're looking at abdominal blood vessels, and we could also repair them if there is a bleed or a leak or anything like that. Next slide, please. Next, we'll talk about CAT scan, also known as computed tomography or CT. And it is kind of, you can kind of think of it in a simple way as like a 3D X-ray that just takes a couple of minutes. And you can see if it's spinning on there on the right side, you can see how the detector actually will spin around as the patient goes through the scanner. Next slide, please. And like I said, since it's a 3D picture, we get more than everything right on top of each other. We get actually what we call slices, where we can see things in a little better detail, and we can also get some better idea of how their position where their position is. So for example, on an x-ray, you may see a spot in somebody's lung, but it might be hard to tell, is it closer to the front or closer to the back of their lung? Well, then if they run a CT, they can see more precisely where that is located at. And next slide, please. And because of this 3D capability, we can also get models like these two, for example. On the left, this is actually a 3D model of a knee, and you can even see some little plastic buttons there showing up. It looks like it was on the patient's pant leg. And then on the right, that is a model of a patient's heart along with their pulmonary vessels, and will allow us to better see if they have a blood clot or anything going on with their vasculature. Next slide. Okay, next we will talk about MRI, or magnetic resonance imaging. If you've ever had a family member or anything talk about being put into a tunnel, this is probably what they were talking about. It's a little different than some of our other radiology procedures in that it uses no radiation. It uses a magnet to make the images. Next slide, please. These are also 3D images similar to how the CAT scan worked, but they look a little different since we were using the magnetic field instead of radiation. As you can see a little better soft tissue detail, and they also have different sequences that show different things like fluid versus bone versus soft tissue versus tendons. You can see on the picture on the right, that is all the same patient, just different sequences, and allowing us to see different things to diagnose what is going on with them. Next slide, please. And this was a neat example I found. This is actually to really show how well it shows detail. This is actually a little clip of a patient singing while in the MRI scanner. You can see all the movement in their tongue and their throat and all of that as they sing, to just give you an idea of how much detail we can pick up on those. Next slide. And this compares to see, you can see the plain X-ray, the CT, and the MRI. And you can see that we can see different things with all of them. We can see the plain X-ray gives us a good look at the bones and stuff in that person's neck. And so does CT, and it shows us a little more detail with the spaces between and the spinal column. But then you can see with the MRI, you can see a lot more detail of like the patient's spinal cord. Next slide, please. So I've talked to you about all these reasons why lately here about how MRI is showing so much more detail. So why don't we do it on everybody? Because it can be very dangerous. Like I said, it's a magnet, and there's no way to turn a magnet off. If anything that is magnetic gets taken into the room, as you can see on the left with the hospital bed, it will get sucked into the magnet. Or as you can see on the right, with the gentleman getting stuck to the magnet. It doesn't quite work that way, but you can go, anything in there can get stuck. So we have to be very careful if a patient has a implanted device like a pacemaker or anything like that, to make sure it is compatible to go into the machine. Next slide, please. Next, we'll talk about ultrasound, also known as sonography. And it's another example that also does not use any radiation. It uses sound waves. Next slide. And first thing everyone thinks about with ultrasound, of course, is babies. And yes, we scan a lot of babies. As you can see on the left, that's what the kind of the traditional ultrasound image looks like. But over the years, there's been more advances, and we can see more than just the gender or birth defects. We can even see some fine details of a baby's face. Next slide. But there's a lot more to ultrasound than just babies. They can look at about any organ in the body as well. And they're a good tool to use, as they also do not emit any radiation for someone that we would want to be very sensitive with that with. On the left, that is an example of a neck ultrasound, and we are looking at thyroid and parathyroid adenomas, I believe what the arrow points to, and you can also see some of the vasculature that can be seen. And then we have an example of a kidney on an ultrasound there on the right. Next slide. We also use ultrasound to evaluate vasculature and the heart. The picture on the left is actually a heart. This is a special ultrasound called an echocardiogram, and it lets us look at how the heart pumps, as well as if you kind of see the little flappy things in the middle, that is actually that patient's heart valve, and we can evaluate how well that valve's working. On the right, we have an example of some vasculature, and that is looking, we'll put color flow on it, and we will try to see if there's a clot or anything like that. Next slide, please. Okay, our final modality we'll talk about is nuclear medicine. And the first thing you might notice here with the example of their scanner is it looks a little different than the other ones. It's got those two big camera heads out there. Well, it's because nuclear medicine is a little different than the rest of radiology. With CT and X-ray, we're passing an X-ray through the patient. With ultrasound, we're passing sound waves through the patient. And with MRI, we're passing a magnetic pulse through a patient. With nuclear medicine, the camera itself does not produce anything. It actually comes from the patient. A patient is injected with a radioactive material, and then that is just a big camera. That material puts off a special light ray that we can't see, but that's what that camera sees. Next slide, please. And so our images are a little fuzzier, you could say, than a regular X-ray, but we're looking a little differently. So as you can see on these examples of bone, this is an example of a bone scan, and they are not as clear as an X-ray, but you can see there's these little bright spots on the one on the left, and on the one on the right, they look like dark spots. And what we're seeing there, those are spots where that person's bone is doing growth or repair work. And that's the whole gist of nuclear medicine. We're not looking as much at the anatomical as we are at how the body is actually working. Next slide, please. And these are some more examples of some of our nuclear medicine studies. The one on the left is a stress test, and that would be, we are actually imaging the patient's heart muscle to see if there's any blockages. And on the right, that is an example of a bleeding scan where we are looking for internal bleeding in a patient. We actually use the patient's own blood and trace it through their body. And the bright spot you see kind of showing up on there and moving around is where that person has a bleed in their intestines. Next slide. And another great thing about nuclear medicine, since it is functional, is we can combine it with other modalities like CT and MRI, and that will let us see, we will see the functional, that we can see, oh, there's something going on there, and we can overlap it with the anatomical, and that will allow us to see where that something is going on at a lot better. Next slide, please. Okay, so I've told you about all of this, and now how can you go about doing some of these jobs? Well, there's a couple different paths you can take. You can go to a rad tech program, and that usually takes a couple years to complete one of those. And you come out there and you're a radiology technologist. You can do all the diagnostic work that we've talked about. And if you would like to move on past that, then you can go on to do some on-the-job training, and you can, or cross-train as we call it, and you can do interventional radiology. You could go to CT or CAT scan, and you could go to MRI. You can also choose to attend a college or a different type of dedicated program if you wanted to go the nuclear medicine or ultrasound routes. You can cross-train into nuclear medicine and ultrasound, but it takes a lot of time, so a lot of people find it's just easier to go back to school. Next slide. Okay, so what is great about imaging? We are really the first to see what is happening. When a patient comes in and thinks they've maybe broken a bone, we are the first ones to see that. And we play a vital part in helping diagnose that patient. And moving on to that, there's a lot of responsibility. It's our job to get the best images that we can to help the physicians diagnose the patients. And finally, we're a vital part of any medical team. Sometimes you don't think about your radiology technologist being on the front lines, but we're right there in the emergency room, in the operating rooms, ICUs. We're even in clinics and veterinary hospitals. Next slide. And that's what I've got for you guys. Any questions?
Gwen, hey, thank you so much for bringing the world of imaging to us. And, just like laboratory, you guys are right there at the most critical moment when trying to figure out what is going wrong or what has gone wrong with somebody's body. So thanks for explaining that to us, and some great slides. We do have a couple questions coming through right now. First one, Calvin from Warrensburg Middle School. Is there a limit to how many x-rays you can have in a year? Good question, Calvin.
That is a very good question. We as workers have a limit of how much we can be exposed to, but there's not really. We try to do a practice that we have that is called ALARA, which means as low as reasonably achievable. It means we do kind of keep a lookout. We don't want to continue x-raying a patient if it's not necessary, but sometimes it is necessary that that patient get an x-ray every day. But we try to watch that. That's a big part of our jobs also, to be an advocate for the patient.
Great question. We have 3 students zooming back in, Mackenzie, Lexi, and Melania. We'll go live. Go ahead and unmute your video and your audio, please.
Yeah. The first question is, as a radiologist, what is the hardest thing to identify?
The hardest thing to identify. Oh, there's a lot of things. It could be. A lot of things aren't always cut and dry. Like, I mean, it's very obvious to see a broken bone, but sometimes it can just be that spot looks funny. And a lot of times what happens then is we will recommend the patient have another test to try to see it better. That's kind of where radiology falls, is we don't want to always say a definite yes or no, but maybe let's try this.
Why do you use computed tomography instead of an original X-ray machine?
Well, an original X-ray, like an example, like would be with a chest. So on a chest X-ray, we're going to see the patient's ribs on top of their lungs, on top of their heart, and it's good to see if like they have a lot of fluid in their lung. But if we would see something like a spot in their lung that we thought was a tumor, then we're going to want to see the CAT scan, and that's going to let us see where exactly that tumor is located. Is it a tumor? Is it next to a blood vessel? Or even do they have a blood clot in their lungs? Is that what we're seeing?
Last question. Does having multiple CTs or MRIs in a short period of time affect your body?
No, you won't notice anything with any of it. If we didn't tell you, you wouldn't know. A lot of times, if we didn't tell you the scanner was on. The only thing with the MRI is sometimes people feel warm inside of it. And part of that's because it is a tunnel, as I said, and it's kind of tight. But sometimes the magnet does get a little warm, but you won't get burned. So
thank you.
Excellent questions. And thanks for zooming in, guys. Really appreciate it. Well, we're getting ready to be at the top of our hour. And Gwen and Larissa, thanks so much for joining us and bringing the world of imaging to life for us. I think a lot of students will be interested, especially the ones that don't really care for blood like I would. Well, thank you for all you do.
Thank you.
Thank you.
So now, as we move into our next session, just a quick shout out to some of the schools joining us. Tarkio High School is joining us, as well as Springfield Public Schools, Fort Zumwalt Schools, and all across the state, as well as in Ohio, Tennessee, and Texas. So on behalf of the Missouri Chamber of Commerce, the Missouri Hospital Association, and the Missouri Department of Elementary Education, thank you for joining us here today. This program would also not be possible without our supporters. Our presenting sponsor, the Chamber Benefit Plan. Our gold sponsors, Mosaic Life Care, University of Central Missouri, Stevens College, and Jefferson College. Our silver sponsors, Hannibal Regional Healthcare System, Ozark Technical Community College Health Sciences, as well as our bronze sponsor, Park University, and our supporting sponsors, the Missouri Behavioral Health Council and State Fair Community Council. So, as we kind of move into the next portion of our program, you know, after seeing all these wonderful careers in healthcare, you're probably wondering, where do I start to make my way in the healthcare profession? Which I hope it's a question you're asking yourself right now. And it's a great question. And fortunately, we have some great experts coming your way. But as you think about this question, I want you to remember, go to the Missouri Hospital Association to Missouri Healthcare Careers website, and you can start to dissect where you want to go in your health career. It may be in laboratory technician, surgical technician. It could be in imaging. If you're good with computers, but don't care for the blood, radiology and imaging may be the spot for you. So it just depends where you want to go.